In myeloma, we've been very lucky that autologous CAR T cells made from the patient's own cells, have been extremely effective. And we're now seeing with the product ciltacabtagene 5-year durable survival and potentially even a cure. So that's fantastic, but we're still limited by the cost and complexity of autologous cell therapy. It costs hundreds of thousands of dollars. Patients have to wait weeks, if not months, for their cells to arrive. So we're really looking for alternative strategies that are available immediately off the shelf. There's a number of these. The two biggest in the CAR T cell world are so-called allogeneic cell therapies and in vivo cell therapies. So allogeneic cell therapies are donor-derived. That means they come usually from a healthy donor. There's also some research in stem cell approaches. And they really have the advantage that they can be made from young, healthy donors with really good, functionally effective T cells. And now, increasingly, you have interest in vivo CAR T cells, which are CAR T cells that are actually made inside the patient's body and can be delivered via lipid nanoparticle or viral approaches and be made right then and there inside the patient.